Welcome back from the break. I'm Dr. Michael Reiner, the host of the Independent Doctors of Pahrump. I'm glad you could be with us here on this Monday night. In the first little segment of the show, we were talking about sleep apnea. We're going to continue that discussion, and we're going to go back to the slide. And I was talking about learning and memory difficulties. And the next segment, or the highlight, shows that obstructive sleep apnea people show tissue loss in the brain regions that actually store memory. So this is something that, if you start to develop memory loss, it's almost too late because, as you start to show that stuff, and we all tend to, worry about developing Alzheimer's or dementia. There are a lot of causes and a lot of things we don't understand, but basically not having enough oxygen to your brain at nighttime causes premature death and premature dropout of very important neurons. High blood pressure is the other thing that may do that in microvascular disease. So it is important that you get in to get your physicals done. And one of the interesting things I'll talk about later is that high blood pressure by itself is one cause of memory dropout, and not the cause of sleep apnea. But if you were to have sleep apnea with hypertension and not having it treated, you would be likely to develop a faster dropout of your neuronal and other important tissues. So it is important that you be attuned to this phenomenon of sleep apnea. If you're in your 40s and your 50s and you're starting to notice some sleep issues, if you're really overweight, over a BMI of 30, you probably want at that point to be aware that you might have sleep apnea and get into your medical provider and talk about that issue and do the simple tests we're going to talk about later. It's really, if you had to pay for it out of your pocket, I believe it's $50 or something. Be careful not to confuse that with getting tired after you eat. That is a normal response. When you ingest food, your circulation engorges in your splanchnic bed, which is around your intestinal tract, to absorb the nutrients. And as your body's trying to process what you just ate, fatigue is a common issue. If you're one of those people that 4 in the afternoon, you're just ready to go to sleep and you're falling asleep on the job, certainly falling asleep while you're driving, and doing those types of things that require a lot of attention, then that might be an indication that you might be trying to develop sleep apnea. Next on the list would be fatigue, which goes along with hypersomnolence, and of course snoring. Snoring is one of those things that is not necessarily a sign of sleep apnea. I want you to be very clear about that. Just because you snore does not mean you have sleep apnea. However, snoring is part of that syndrome, or that complex of associated symptoms with sleep apnea. So let's suppose you have a BMI of 30 and you're falling asleep in the afternoon and your wife says, I got to move to another room because you're just snoring like a freight train. A light bulb should go off after this show in your brain to come in and see somebody about getting yourself tested to see if you have sleep apnea. And no, you do not have to go to a sleep lab to have that done. This can be done in the comfort of your own home. Okay, let's go to the next set of slides, which will show the risk of not treating sleep apnea, and this is something that's very important. And one of the things I wanted to look at is hypertension. I briefly talked about that a little earlier. Hypertension is, the hypertension associated from sleep apnea is different than the hypertension associated from an iatrogenic cause, which means a cause due to most of blood pressure. We don't know why it becomes elevated, but let's say it is due to sleep apnea. The key to that sleep apnea hypertension is it does not go down when you go to sleep. If you have iatrogenic hypertension, the one that we see the majority of, it tends to revert to normal while you're sleeping. Very clear distinction. The other one I mentioned in the slide was pulmonary hypertension. This is an irreversible condition. This is a very dangerous situation that develops as a result of continuous or prolonged decrease in saturations of your lung tissue. So what that means is that as you have sleep apnea and you don't breathe as well, or you obstruct your airway, your saturations, and I have some diagrams of that later, shows exactly what happens in this situation. You basically start to see your saturations in your blood drop low. That would wake you up out of sleep. If this is a prolonged situation and you're taking sleeping pills or pain medication and you can't wake up, then the pulmonary, this short circulation from the right side of the heart through your lung to the left side develops hypertension, and it cannot be reversed with hypertensive medications as of today. They've done some work with some different medications, but as far as I'm aware, this is an irreversible condition. If you get right-sided heart failure as a result of pulmonary hypertension, you do not have a very good prognosis. You probably, and depending on the severity, it could be up to 6 months or less. So a good rule of thumb is don't let yourself get into that situation. Next on this slide, we talk about heart attacks and actually strokes and heart failure. Again, this is just a kind of a no-brainer that if you are running into difficulty with your oxygenation, your body is going to try and wake up. That secretes norepinephrine. You're tired. You're never really getting the rest you need. Your heartbeat increases, and that's what we see a lot of times on these studies, is that the oxygen saturations go down, your heart rate goes up. This puts a strain on your heart, which could break open an atheromatous plaque in your arteries and lead to a heart attack. Enough heart attacks, enough hypertension, you develop congestive heart failure. And yes, sleep apnea can lead to obesity. How does it lead to obesity? Usually you're obese before you get it, but it certainly will make obesity worse. In that situation, you're tired, you don't feel like doing anything. All you kind of want to do is feel sorry for yourself. Maybe you want to eat. And those are things that leads to further obesity. So if you start out with a BMI of 30, and then all of a sudden you find in a year you're at a BMI of 35, and you're putting on a lot of weight and you're not getting any better, might be time to think about getting into the doctor. Okay, next on the slide would be, again, sexual dysfunction and depression. We talked about that again. Sleep apnea leads to a decrease in testosterone production, which leads to a decrease in sexual function. I also, at the bottom of that slide, mentioned loss of job. If you're one of these people that need a CDL, they're really cracking down on large BMIs. They're going to require you to have a sleep study to prove that you do not have sleep apnea. Your job is out driving. Driving is boring and monotonous most of the time, combined with sleep apnea. You may be hypnotized into falling asleep. So they're very, very aware that this is a major problem. And again, that leads to loss of income, loss of your job, and then bodily harm and injuries for those that don't have DOTs or are not a commercial driver, just driving that drive to Las Vegas. I mean, you get out on an open highway, people just fall asleep, and the rollovers and all the other problems that occur could be prevented had you decided to pay attention to your symptoms and decided to get into a doctor or a healthcare provider to have them find out whether or not you have sleep apnea or not. We're going to go to the next slide. And this is basically how we diagnose sleep apnea. This is that simple test that I talked about. And these are 2 slides. I did see this. I did actually have this on the last show, but I've combined this slide now. And we're going to come back from break, and then I'm going to go into more detail on those particular slides and what they mean and how to interpret them. We'll be right back. Thank you for tuning in.